My name is Danielle Rajecki, and I am going to demonstrate how to insert a Foley catheter. Upon entering the patient's room, I am going to wash my hands, and I would introduce myself to the patient, ask the patient if they could identify themselves. Two good identifiers would be their name and date of birth. I want to check that against their wristband. Upon doing so, I also want to ask if they have any allergies. After I do that, I'm going to explain the procedure to the patient and go ahead and get them set up. This patient is a female, and I would ask that she please flex her legs up for me, or her knees up, and bend her legs outward. Okay. Now I'm going to go ahead and get my kit set up, get my sterile field ready. When I'm opening my kit, I want to make sure I'm only touching the outer 1-inch margin. I'm going to slide this over, get my sterile gloves ready. I'm going to go ahead and get these on. I'm going to move my kit over to the bedside. Okay. I want to make sure I'm not touching anything. I'm going to get my drape ready to put underneath the patient. I want to make sure I'm tucking my hands in on the inside to prevent them from becoming contaminated. If the patient is able to lift herself, I would ask her if she could do so. If not, I just try to slide it under there the best I can. Okay, and I'm going to go ahead and get my drape, cover my patient with it so that the area, only the area that I'm working with is exposed. Okay. Now obviously this is not a new kit, but we're going to pretend that it is. This would be my surgical lube. I'd go ahead and get it opened, squirt it inside my kit, open my betadine. And now that I'm touching my patient with this hand, I have to keep it here. Can't use it anywhere else. So I'm going to go ahead, and when I use the swabs, I'm going to use each swab only one time. I'm going to go on the outside, up to down. Other side, or from top to bottom. The middle, from top to bottom. Okay, now this is still my sterile hand. So I'm going to go ahead and get my catheter out with this hand. I want to make sure when I'm taking it out that I'm not whipping it around everywhere, contaminating it. So I'm going to dip it in my surgical lube. And I'm going to go ahead, bring it over here. Insert it into the patient, to the urethra. And I'm going to want to advance this, if I can get it inside. Advance this until I see urine come out, and then I'm going to want to go about another 1 to 2 inches to make sure it's in the bladder before I inflate the balloon. You never want to force it into the patient if you're meeting resistance. Okay, so now that I have it in there, I'm going to go ahead and inflate my balloon. And once the balloon's inflated, I can detach the syringe. And I just want to give it just a little tiny tug to make sure it's in there, nothing really forceful or anything. Once I have it in there, I would want to secure this to my patient's leg. I'd want to make sure there's a little bit of slack in case the patient got out of bed or moved around. You don't want them to pull it out. And that is how you insert a Foley catheter.